January is Cervical Cancer Awareness Month. According to the American Cancer Society, around 13,000 women are diagnosed with the disease every year, and more than 4,000 women will die from it. We're joined now live in studio by Dr. Jennifer Aguayo from Kaiser Permanente Los Angeles Medical Center with important information women should know. Welcome. It's so important to be here to talk about this.
Good morning.
Good to have you. So let's just talk about what causes cervical cancer.
The majority of cases of cervical cancer are due to persistent infection from the human papillomavirus, particularly the high-risk types. Most of us will be exposed at some point in our lives, but it's persistent infection that causes cervical cancer.
And so when you say persistent infection, is there a way to, if you say most women are exposed at some point in their life, I know there's a vaccine available for younger girls now, and how do you prevent a persistent infection? How do you prevent an infection from persisting, maybe I should say?
Yeah, so our immune system is actually strong to clear the infection. The majority of women, we clear it within 1 to 2 years, but it's the persistent infection that can cause those changes. Now we have a vaccine that's widely available to both boys and girls as early as age 9, and ideally you want to be vaccinated by age 13. And most recently we expanded the vaccine availability to women up to the age of 45. Especially if you've been treated for precancer of the cervix, that vaccine really helps decrease the recurrence of persistent infection.
What are the signs and symptoms people should be looking out for?
Yeah, so unfortunately there aren't any signs or symptoms, otherwise folks would present earlier. It is something that we pick up in cervical cancer screening. But in later stages of high-grade dysplasia or cancer, women can have bleeding, particularly bleeding after intercourse or an abnormal vaginal discharge.
And so how often should women get screened? I mean, this is the tricky thing about these sneaky types of cancers, when you don't know that you might be having some of the symptoms. So how often should women get screened? How early should girls get screened? And is there anything males can do?
Absolutely. So we start screening all women at the age of 21, and the frequency of screening depends on your age, as well as if you've had any abnormal results in the past. But most women get screened between every 3 to 5 years. Unfortunately, there is no reliable test for men, and men don't manifest the symptoms or the pathophysiology like women do. So it is important for us women, young women at the age of 21, to frequently see our obstetricians and gynecologists or our primary care physicians.
So it's a situation where the men and even teen boys can be spreading it and not realizing it, having no idea.
Absolutely, and that's why it's important to also get our boys vaccinated.
And are there any other risk factors for the disease that make you more susceptible?
Yeah, certain autoimmune conditions, particularly if you're taking medications that weaken your immune system, HIV, smoking, are known risk factors that can worsen.
And I know this has been kind of an evolving science. I think a lot of women, in their 40s didn't know there was a vaccine available, or it wasn't available when they were young. So are you seeing a decrease, at least, in the younger women now that they've been vaccinated?
We are. We're seeing a decrease also in the precancer stage, and also the amount of procedures that we have to do to diagnose early. So the vaccine is highly effective at protecting both boys and girls.
So your advice to someone who may have had it and is recovering from it, or may have just been diagnosed with HPV?
My advice is stay on top of it. Come to your routine testing. Make sure your doctors, if you're switching doctors, know about your past history. Stay healthy, and check today to see if you are current on your exams.
All right, thank you so much for being here. I know you have all kinds of events coming up, screenings and all types of opportunities. So I think just getting the word out is really, really important.
Very important.
Just raising that awareness. So thanks for coming in today.
Thank you for having me.
Appreciate it.
Absolutely.